All right, today we're diving into some really fascinating new research. We're talking about complementary approaches that can work right alongside standard leukemia treatments. We're going to explore evidence-based options that could really empower your healthcare journey.
You know, if you or someone you love is navigating a leukemia diagnosis, it is completely understandable to be looking for every single way you can to take an active, supportive role in your own care.
And that's exactly what this is all about today. We're not talking about replacements for conventional oncology. Not at all. We're talking about powerful, evidence-based tools that can support it.
Okay, before we go any further, let's pause because this is probably the most important thing we'll say. Please remember, none of this is medical advice. Our goal here is to share some high-quality information that can help you have a better, more informed conversation with your medical team. Think of this as a conversation starter, nothing more.
First up, let's talk about the good old sunshine vitamin. The research on vitamin D, especially for early-stage chronic lymphocytic leukemia, or CLL, is just incredibly compelling.
So, for a lot of people diagnosed with early-stage CLL, they go into this period of active surveillance, which you might have heard called watch and wait. And a huge question on their minds is, of course, how long is this going to last before I actually need treatment?
Well, a study of over 900 patients found something pretty striking. For patients under 65 who did not supplement with vitamin D, the average time to their first treatment was about 84 months. But for those who did supplement, that time jumped all the way to 169 months.
Yeah, let that sink in for a second. That is more than double the time, a 101% increase in the period before treatment was needed. And this was just from what the study called low-dose supplementation. This isn't just a number. For some people, this could mean years of a higher quality of life before needing more aggressive therapy. It's a huge deal.
Okay, moving on to our second area of research, we find a much more surprising ally, statins. You know, those common cholesterol-lowering drugs? Well, they appear to play a really unexpected role in leukemia care.
So, a really solid study took a look at almost 1,500 patients who were being treated with a specific targeted therapy drug called ibrutinib. And inside this big group, researchers started to notice this powerful connection for the patients who also happened to be taking statins.
And the results were pretty significant. For patients who were also taking statins, there was a 61% reduction in the risk of dying from the cancer, and a 38% reduction in the risk of dying from any cause. These are really powerful findings that suggest a real disease-modifying effect.
And hey, just a quick side note for that talk with your doctor. It's worth knowing that a widely available supplement, red yeast rice, is actually the natural source of lovastatin, which is a type of statin.
Okay, next up, we're going to shift focus from vitamins and drugs to this vast, incredible ecosystem living inside all of us, the gut microbiome. The evidence is really piling up that the health of our gut bacteria plays a critical role in how well treatment works.
Here's the challenge that researchers have identified. Failures in therapy, especially around things like stem cell transplants, are being linked to low levels or even a complete absence of a couple of specific beneficial bacteria, namely Blaudia and Akkermansia.
And this is the finding that really stands out. In one study looking at stem cell therapy, every single patient, 100%, whose therapy failed was found to be missing that Akkermansia bacteria. It's a pretty stark indicator of just how important this little microbe might be.
So, what can be done about it? Well, the research points towards dietary support. Things like walnuts and oat glucans have been shown in studies to help increase the diversity of our gut microbiome and specifically help out these beneficial bacteria.
Now, how about a quick lightning round? Because the three examples we've just covered are really just the tip of the iceberg. Let's briefly touch on a few other areas of promising research, just to show you the breadth of what's being looked at.
First up, danshin. This is a traditional Chinese herbal medicine. When it was used alongside chemotherapy in several clinical trials, it was associated with a risk reduction for progression of around 75%.
Next is lactoferrin. This is a protein that helps your body balance iron. And this is so critical because healthy hemoglobin levels are very closely linked to getting to and staying in remission in blood cancers.
And finally, astragalus. A huge analysis of national patient records in Taiwan showed that using herbal medicines, with astragalus being one of the most common, was associated with a 59% average reduction in risk.
So, let's bring this all home. We've looked at vitamin D, statins, gut health, and a few others. What's the next step? Well, it's all about taking this information and using it to partner with your doctor.
And let me be perfectly clear one more time. This knowledge is not a guide for self-treatment. It's about empowering you with credible, evidence-based information so you can be a more active participant in your own care.
This is the key takeaway. Nothing is more powerful than that partnership you have with your oncologist and your whole healthcare team. You know, an informed patient is truly an empowered patient.
So let this be your starting point. Take these studies, take these ideas, take these questions with you to your next appointment.
And so we're going to end, not with a statement, but with a question for you. Based on everything you've heard today, what new conversation will you start with your doctor?